prostate... enlarged blood... Walao wei. BPH is not scary. Waking up in the middle of the night to pee, or often finding yourself having to empty your bladder regularly. If you are a man facing with such issues, you might be suffering from benign prostatic hyperplasia, or commonly known as BPH, and we're here to talk about it. Today we have invited a very special guest, Dr. Ronny Tan.
Hi, Adam. Hi, I'm Dr. Ronny Tan. I'm a consultant urologist in private practice. My practice is called Advanced Urology, and I run my clinics in Mount Elizabeth Hospital as well as Parkway East Hospital.
I have a few questions with regards to BPH that my relatives has asked me, so I hope you are able to help me clarify them.
Yeah, sure.
So, Dr. Ronny, is it true that only elderly men gets BPH?
That may not be true because we know that every man has a prostate and it increases in size as we age. So the ballpark figure we take will be about the age of 50. 50% of men age of 50 will have enlarged prostate. It can increase up to about 80% in patients reaching the age of 80.
Is it true that prostate screening is only for those with enlarged prostates?
Okay, that's not true because every man has a prostate. As you grow older, the prostate increases in size. So the thing that we will tell our patients will be whether they have a family history of prostate cancer. Those with a family history of prostate cancer should get it checked earlier, probably in the age of 40 to 45. Those without prostate cancer at least should start screening the prostate at age 50.
So, doctor, what are the tests available?
Okay, when you come to the urologist clinic, we will do a physical examination as well as investigations. So a physical examination will entail a digital rectal examination. Basically what I will be doing, I'll be using a glove finger with lubricant. We put it up the rectum to feel for the prostate. That will allow me to feel how big the prostate is, the consistency, as well as whether there are any hard nodules that suggest prostate cancer. Other tests that we do will be urine tests. One of the urine tests that will be done to look for infection, look for blood in the urine. A special urine test called Urethral, where we will be able to assess how fast a man is able to pass urine. Other tests will include ultrasounds. We will do the ultrasound of the urinary tract, namely the kidney, the bladder, as well as the prostate itself. And then the other test that we do will be a blood test, what we call a tumor marker. The common tumor marker that we use is PSA. Sometimes PSA is also offered in the health screening packages that the GP will provide.
Doctor, is it okay to let my prostate grow as long as I can still endure the symptoms?
The enlargement of a prostate doesn't do anything to itself. It actually affects the bladder, which is why you have symptoms like urinary symptoms. So if you leave it alone, what happens is you can have complications that will occur in the bladder. For example, infections. Patient can develop bladder stones. In the worst scenario, the bladder can fail. And should the bladder fail, there's also always a risk that the kidneys will fail because of the bladder failure. So of course, the size alone is not the main issue. Of course, size does matter, but the key will be whether this prostate actually obstructs the bladder, resulting in the complications that I mentioned earlier. So, should you have symptoms, it's not good to just let it grow. You should always seek help with the urologist.
Is BPH surgery painful? Because I heard that it cuts, it burns your prostate off, so it's kind of scary for the general public to hear about it.
As urologists, we use a lot of techniques to try to reduce the size of the prostate. You're right, we have used electricity to cut the prostate, we have used laser to melt the prostate, and also other newer surgical techniques that we've used, including water vapor. We have used microwave, and then there's also another treatment where the prostate is not being destroyed, which is what I call prostatic urethral lift. These three are actually known as the minimally invasive techniques. So for the procedure prostatic urethral lift, basically there's no destruction of the prostatic tissue. So you can imagine, for example, if your prostate is like a curtain that's actually blocking, what we do is actually we pull the curtains apart and then we tie it up with curtain ties. So this will allow instead of light coming out, now we have more urine coming out from the bladder.
So how long does this procedure take to recover?
Most patients who undergo prostatic urethral lift surgery, they will either stay overnight or can even be discharged on the same day. Some patients go home without the catheter. At most, you just keep the catheter overnight. So I would say that a lot of these patients who undergo prostatic urethral lift can resume their activities maybe the following day or the day after. So BPH surgery is not scary.
Thank you, Dr. Ronny, for clearing our doubts today. So if you do find this video useful, make sure to share with your loved ones.
If you find that you experience some of the symptoms that we have mentioned in terms of urinary symptoms, or if you are generally worried about your prostate health, feel free to reach out to a urologist.
Make sure to follow Medical Channel Asia for more health information like this.